So what happens is that whenever, especially in the case of an athlete, whenever there is an axial loading of the knee, and simultaneously there is a pivoting motion. So whenever the foot gets stuck and the person is doing a forceful knee bending exercise, might be during playing or might be when the foot gets stuck. So that's when the tears develop. So meniscus tears come in various shapes and sizes, and so do the symptoms actually. So one may present with just a diffuse pain in the knee, either on the inner aspect or the outer aspect. Somebody may present with extreme pain and locking of the knee, inability to straighten the knee or inability to bend the knee. Or some people complain about difficulty to squat, some people complain about difficulty in sitting cross-legged, and many people just complain that they have a problem while climbing the stairs or going down. So meniscus tears can be notorious, as I said. Sometimes we first have to understand what are the surgeries available to treat a meniscus tear, and also we have to understand that whether they were associated, as they say, osteocartilaginous defects, which are basically injuries of the cartilage, that the knee cartilage, the surfaces of the upper bone, that is the femur, and the surface of the tibia. So you're right in saying that he underwent multiple procedures, but what exactly those procedures were is difficult to tell. Whether they were balancing of the meniscus or whether they were repairs of the meniscus that could not heal. So the thing with these tears is that they sometimes are very notorious to heal. Meaning that, meniscus is not a very vascular structure. Meniscus does not have a very good blood supply. Only the outer part of the meniscus gets a good blood supply. The inner part is relatively avascular, or to say that it doesn't have a good blood supply. So it's very difficult to tell why he underwent 3 surgeries, but unfortunately he could not recover. Also, these days the demands of the tennis calendar are such that players are always complaining that so much of tennis is being played around the year that the demands of the modern professional games are so high that for an athlete to undergo 3 procedures and then come back to the circuit. Basically, if the tear, as I said, is in an area where the blood supply of the meniscus is good and we expect the healing to take place, then a repair procedure is better. And if we find that the tear is in an area where not much healing would be possible, so then a balancing of the tear is usually performed, which may be in the form of a partial meniscectomy, which involves removing only a part of the meniscus, or it may even involve subtotal meniscectomy or total meniscectomy.